Welcome back to the Arise interview. I'm Charles Aniagolo. Now, the global pandemic has changed all our lives and will continue to do so for years to come. But for people living with physical challenges, the problems have been big, from loss of essential services and supports to abuse and a lack of understanding of their needs in public spaces. People with learning disabilities in particular are said to have been left behind in terms of protection because the COVID-19 vaccine can only be delivered by injection. And people who are clinically extremely vulnerable would flip completely if approached by someone with a needle. According to one study, such people are up to 6 times more likely to die from COVID-19. And that means that their families are also at high risk of dying from the virus. Well, let's speak now to Olaide Awosedo, founder of the NGO for physically challenged women, known as Gallant Women Ability Foundation. Thank you very much indeed for coming in.
All right, good evening. Thanks for having me.
Have the human rights of people with disabilities been placed in more danger by the coronavirus pandemic and the restrictions that have come with it? I should say physically challenged people.
Yes, I would say it's been very, very difficult for people with physical disabilities, and because they kind of refrain inside their housebound, they can't really go out to get things for themselves. And during the pandemic, it was really difficult for them to do a lot of things because they can, especially those who do a daily livelihood, they can't really go out to do their jobs again, and those probably they expect people to come to the house. They can't really, have people around coming to the house to feed them or probably to give them things or probably for healthcare, purposes. A lot of things went really, really pear-shaped really during the pandemic, and it's affected people with physical disabilities. And
so people who would normally come to take care of them or be with them and so on simply could not come because of the lockdown.
Yeah, because of lockdown. And those who have the daily livelihood, who go out to fend for themselves, they were not able to do that anymore. So poverty increased on that aspect. Poverty increased, a lot of things went down, and health as well. They were unable to access, healthcare checks, and depression came in, societal thoughts came into them, and there were a lot of psychological, impacts which really affected them, and so many things went down, and it was really affecting people with disabilities because they can't really go out to fend for themselves.
Right, and you, of course, you live in the UK, but your NGO straddles both Britain and Nigeria. What was it like for people? Because at least in the UK, I mean, we know that there is special focus on people that are physically challenged. What was it like for people in Nigeria? What has it been like for them?
In Nigeria? Yeah, in Nigeria, like where I'm coming from, there's a structure already in place. But compared to Nigeria, the structure really is not there. So what's the disadvantage of this is that a lot of things were not put in place. Like they don't have the testing system, they don't have access to the vaccine. Probably healthcare givers can come because they don't even know the number of people. The figures are not there. The data is not there for them to know who is this. And they can't really, so there has to be a need assessment. The provision for needs assessment wasn't there. So they can't really say, oh, you need this, you need that for us to be able to, give you access to health checks or probably stipends or anything. And with that, probably it would have been much easier if there was data for them to work with. They can know how to give them financial support because most times really it happens with financial impacts. That's what it's all about mostly. Then we'll talk about the health issues. The financial impact is that if government was able to fend for them, at least know their needs, they can assist them with stipends, they can assist them with food banks, whereby they don't have to go out to fend for themselves. There can be provisions and resources for them to be able to, access a lot of things. Even if they don't, the caregivers, they don't have to see them in person. There should be probably a provision for them to access point A and point B. Okay, everyone who is physically challenged, go to point A to get this done. a lot of things.
And that's not happening in Nigeria.
It's not happening at all.
Right. And you have an NGO that focuses more really on women. It's called Gallant Women Ability Foundation. Tell us about that.
Gallant Women Ability Foundation is a movement to support physically challenged women and children living with disability. And as you can see, I'm a living testimony, a survivor of, an accident, road traffic accident. So the thing is, we support women to empower them and promote independent living. I would say independent living to be self-reliance, to be able to do things themselves without relying on other people, to also equip them with skills acquisition, to not limit themselves really, because a lot of people probably when they have accidents or probably they have physical challenges, they think it stops there. Life does not stop there, because what they usually say, they said if education is expensive, try ignorance. The thing is, being physically challenged is hard enough, and you being ignorant or probably not integrating yourself into the society is worse.
But a lot of it is psychological, though, isn't it? I mean, people have to be
self-confidence.
Yes, they have to be inspired. And pushed to, encouraged to do things. And when that encouragement isn't there, it's very difficult, isn't it?
Yeah, the thing, it starts with us, because like I said, in some of our slogans, we say we're in this together, because it starts with you, it starts with me. We have to help each other. We have to inspire each other. We have to dare each other to be able to do things. Like it happened to me, when I was newly into this being disabled and all that, but physically challenged. A friend of mine just, told me, you need to come out of your shell, because most times I'm always indoors. I'm always so, low self-esteem, and I don't even get on buses. But all of a sudden, I just found myself going to school. I had my first degree, and the acceptance I got in college, in uni, made me feel, oh, everyone wants to help me, everyone wants to be my friend, and everything. And I got that, and I had my second degree as well, and I was like, it's happening, the acceptance, and that is why we're talking about diversity, whereby people need to accept people who are physically challenged.
But you did all that in the UK. Then.
Yes.
Yeah, it's a little more difficult in Nigeria, especially around issues of poverty and all that sort of thing, and ignorance and a lack of education.
It's not happening in Nigeria. So that's why we at GWAF, I believe, with the support of the government, we're able to, make a change.
I understand you're doing things with IT and all the rest of it, trying to get women, together, physically challenged in that direction.
Yeah, and we're trying to put them in jobs. We're trying to give them facilities and resources whereby they will be able to come out strong and be self-reliant, be confident to do something for themselves with dignity. There's dignity in all jobs.
Absolutely.
There's dignity in everything you do. But first and foremost, you need to have the confidence. You need to have the self-esteem, that not to be low self-esteem, but you need to have that big confidence in you and say, yes, I can do this. So it comes from the inside, and it also comes from people around you, accepting your uniqueness, being physically challenged, do you understand? And there has to be inclusion as well. Inclusion means whereby the government policies, legislations are there for you, and there are resources and facilities for you to work with.
Right, okay, we've got like 10 seconds to go. If they wanted to get in touch with you, somebody's watching this, they think, wow, how do they do that? Is there a website or something that they can
yes, it's GWAF, that's G for Gallant with an hyphen, W for Whiskey, A for Alpha, F for Freddy, .org. That's the website. So you can get all the details. And as I will be having a program to launch the foundation in Abuja on the 14th of May. So everyone is welcome to come and join us.
Thank you very much indeed. Olaide Awosedo, founder of the NGO for physically challenged women known as Gallant Women Ability Foundation. Congratulations and keep doing what you're doing.
Thanks so much, sir. Thanks for having me.
That's it for this edition of the Arise interview. Join us again tomorrow from me and the entire team here in Abuja. Bye-bye and thank you for watching.